Hello, and welcome to the Cultivating Confidence podcast. I am your host, Dr. Nicole Grams. I am a life coach who specializes in anxiety, health, and human design. And I also happen to be a functional medicine pharmacist. This podcast is a compilation of conversations that I've had with clients and colleagues. So listen in as we explore the mind, body, and soul's confidence in its many forms. All right. So today's unscripted episode, I have with me again, Dr. Sarah Jastram from Minnesota. I think we're going to have a completely different conversation than we had last time. Today's topic we kind of have before we started recording, which is refreshing, kind of in a way. Anyway, we were just in a conversation previous to this, and we happened to come across the topic of trauma in like medical context, not medical trauma, but like the emotional trauma that people can have when they are going to the doctors or as healthcare professionals, the trauma that we have in trying to make a difference in what's going on. So, yeah, where do you want to start?
Well, I want to start with where we also have that trauma. I mean, we have that, like, it started with we were in a coaching session, we were chatting, and I brought up the fact that I had heard somebody speaking about trauma, and they were defining trauma as too much, too soon, too fast. I think there was another two in there, and I can't remember. And I was like, my initial response was, well, that hasn't happened to me. And then the more she explained trauma and the more she explained the kind of the different insidious facets that it takes and it presents itself, I realized that one of the things that I struggle with as a pharmacist is something that I would identify as trauma in my pharmacy education. And that was really surprising to me, because it then was like, oh, this is part of the reason why, as much as I am excited and proud and happy that I am a pharmacist, it is a love-hate relationship. And especially with a lot of pharmacists that I might encounter in my state, or kind of in, like, beyond the functional medicine world, right? I'm going to kind of say, like, my more traditional pharmacy colleagues, I approach with a certain level of hesitancy. And I realized it was because of these experiences in pharmacy school, which, you know, like, who thinks that they're going to experience trauma in pharmacy school?
I mean, I have my fair share of it, but different sort of,
but you don't expect it. It's not like you went to pharmacy school and you're like, you know what, I'm going to get
trauma.
And I think that there's probably nurses and physicians and dentists and you know, I think all of the healthcare professions, like, not only, like, there's the potential that they experience it within the educational setting, and then you have another layer of it when you get out into the workplace.
So I guess we forgot to disclaimer, we are not trauma experts or have extensive training in trauma, all this stuff. We just wanted to bring this to the forefront of a conversation because we think it's a conversation that needs to be had. And it's not talked about a lot. And it can leave people feeling isolated and alone. And the intention here is just to bring light on it so we can all do our own research. But this is what we're going to say here today is our own opinions and our own experiences, and take that for what it is, or reach out to us if there are any questions at all. So,
I think to add to that is that part of, I mean, I would just say, like, part of one of the things as a practitioner working in healthcare with patients and understanding that it is very, very likely that my patients have experienced trauma.
Mhm.
And like, yeah, I'm not an expert by any means, but I think like making space to have the conversations and then recognizing that it's there and it's not just veterans who have
Mhm.
PTSD
Right.
or, you know, that it's a lot more prevalent than maybe, I mean, I can't even say then we're taught because we're not taught.
Right. It's a thing that happens and we respond in the way that we've been conditioned to respond. And the same situations for some can be traumatic for others. Like it's there's no the only thing that really defines trauma is how you respond to it. And some of us are not given a full deck of cards to play with from that perspective of emotional maturity and all this stuff, like having a safe space to work through any of it. You know, it I mean, there's so many different levels of of what we're talking about here. So
Yeah.
yeah. So what you
Um,
had kind of said that kind of raised the tell me again, like briefly, what you kind of said that raised this whole topic in our session.
oh, so I had a certain level of like, I recognize that something that I experienced in school, I identified it now in this context. I was like, oh, I think that was actually kind of traumatic, where I had gone to pharmacy school to learn how to get people off drugs. Like that was the basis for my entrance interview.
And by drugs, we're talking about medications, right?
Yes, yeah, medication
In this context.
I mean, like
Anyway.
if I want to help you get off your illicit street drugs, I mean, I'm not necessarily the
Right,
best
that's
person
not
to go to,
excluded.
but like,
But what we're
I'll
talking
be
about
inclusive.
is prescribed medications, reducing
Yeah,
them. Yeah.
yeah, reducing prescribed medication usage,
Mhm.
and so inevitably, I'm in a class, and at the top, they put up a picture, the slide with the guidelines, and at the top of the guidelines, it says diet and lifestyle for 3 to 6 months, and if that doesn't work, go to the next step where you start assessing risk and
Mhm.
adding in pharmaceuticals. And
Mhm.
I raised my hand and said, what is this top part? Because our professor had just jumped into the pharmaceuticals aspect. And I was told point blank in front of all of my classmates that nobody can um, achieve the changes through diet and lifestyle. They can't do it. So we're not going to talk about it in class. And that particular moment has like really, really stuck with me because I mean, I don't want to say I was young and vulnerable because I
Mhm.
certainly wasn't young or very vulnerable, but at the same time, I was
In
very
ways you were.
impressionable.
Yeah.
Yeah. I was, it was like my second year of pharmacy school. So I
Mhm.
was still like figuring out this whole pharmacy thing. And I learned very quickly to not bring up ideas about diet and lifestyle or acupuncture or massage therapy
Mhm.
or hypnosis or craniosacral therapy or like
Mhm.
all of these other things that I was doing on my own to manage the stress of being a parent and in pharmacy school and working my internship and all of that stuff. Um, and so then this is at this meeting. So I'm sitting here connecting these things. And then I'm in this conversation about resilience and burnout in the pharmacy setting.
Mhm.
And they were like, well, we'll send out emails about like how you can go to um, how you can make sure to take a 5-minute walk on your break, or how you can meditate, or how you can, all these things that are like self-care, an email that lists all the
Mhm.
different self-care things you can do through the day. And
Yeah.
I was like, lady, that is not going to help somebody with self-care. They're going to
No,
look at that and be like,
I don't have time for that.
I don't have time for that. I have
Yeah.
like 27 physician orders I need to deal with, and like
Right.
people who are dying on my floor from illnesses that I don't have the capability, the means to treat them.
Mhm.
And you're going to tell me that going on a 5-minute walk around your like stinky basement hospital building is going to help? Like, No. And it just struck me that there's this perception that we can like email our way out of out of this problem, or we can have conversations on resiliency. Here we are having a conversation on trauma, but
right.
it made me so angry because I'm sitting here going, I'm 5 years into my pharmacy career. I spent 4 years in school. And in my second year, I was saying, why aren't we learning about how to eat healthy and take time for self-care?
And being completely shut down.
And being shut down. And here you are saying we should send an email about eating healthy and doing self-care. And I'm like, maybe you should teach your students that every 20 minutes they need to get up and walk around for a minute and then sit back down so they can concentrate on what you're learning.
Yeah.
I'm gonna get all fired up.
Yeah, I just wanted to join in with, I don't have any specific examples of my own trauma in this context in pharmacy school. But I definitely, looking back, can see that I was always open to alternative things, and like you said, the acupuncture, chiropractic, all this stuff. But I was very young when I started pharmacy school. Like I was 20 when I got in. So I had not lived any of my life. I had gone straight through school, like fast tracked my way in. I don't have any life experience, but I didn't necessarily go in with the intention of, helping people get off of medications, but I went in with the idea of helping people be healthier, right? And now that means something very different than what it did at the time. But there was also a level of like, oh, well, this class on herbals, it's there if you want to take it, but like, it's just going to create supplements just mean expensive pee. Right. So like, literally that's what professors said to us.
Yes.
Like now with the hindsight of like actually learning about how food interacts with your body, it makes like, because clearly food is the issue that causes the disease, but it's not the answer. Like, wait, what? We could just switch things around. But anyway, but yeah, there's a certain level of trauma around like not being able or feeling like it's a safe space to speak up. And I want to take that to patients as well, because I think that happens a lot, especially for patients who want to do diet, lifestyle, exercise, mental health care, and their physicians are just kind of shutting them down, or they don't really know much about it. And I will be the first to admit, I kind of was one of those providers at the pharmacy of the, like, I told people that supplements just make expensive pee for a long time, for several years, right? Like, it, in hindsight, that's horrifying to me. It's really more about the quality of supplements and why you're taking them and which ones you actually need. And there's a lot more to it than that. But anyway, holding space for yourself to be able to speak up in the medical context can be very traumatizing. And I have run into so many patients who have this issue and they just feel like they've never been heard.
Yeah. I think that's a huge part. And I think it's something that, like, we as clinicians need to learn how to listen better.
Yeah.
And by better, I mean almost like
at all.
Yeah. Like we need to learn how to listen.
Yeah.
And I think, I go back to, this is funny because I've been talking to a number of different people. I keep going back to my marriage counseling. But that was where I learned active listening.
Yeah.
And then in pharmacy school, they were like, okay, we're going to practice this listening technique called active listening.
Yeah.
And I think it's a shame that and I don't know if it's just like the age or what, like, I don't know what, like how, if it was how it was presented or what was the situation, but it was one of those activities in pharmacy school. Everybody was like, oh, we have to do this.
Yeah. Yeah.
And then
100%.
Like, and then somebody's like, okay, I'll be the patient.
Yeah.
I I'm
I
looking
mean,
at this
yeah, you have
supplement
to,
and I hear you say you're looking at this supplement. And
right.
like, I don't know if there's a way that it could be taught better, or with a better emphasis, or with a more a better understanding of like, no, this is the heart of what you are going to be doing.
Mm-hmm.
Because not only is it how you listen to your patients, it's how you listen
Yeah.
to your colleagues as
Yep.
well. Right? Like, the last thing I want to do is walk into a pharmacy as the pharmacist and have a technician tell me that I can't talk to the patients about their supplements, or I can't go out into the aisle and talk to the
Mm-hmm.
people about their supplements because I have too much stuff on the bench, which I have been told
Multiple times, probably.
multiple times.
Yeah.
So this might be like an eye opener for some people about what
Yeah.
pharmacy profession is like,
Right.
but
I mean, and it's not limited to just pharmacy. Let's say that, because it's absolutely not. But yeah, go on.
but to say, no, we have to listen to each other. And
Mm-hmm.
the person who's saying like, I can't have you go out as the only pharmacist, I can't have you go out into the aisle, what really they need to be saying is, I really need your help because it's really busy and I don't feel like I can do this work by myself.
Mm-hmm.
And I feel like I'm doing it by myself when you leave.
Yeah.
Because then
Yeah.
I can say, I hear that,
Mm-hmm.
I'll come back. I understand how much work is going on, and let's have a dialogue about how we manage things. And now all of a sudden we're doing I statements and listening, as opposed to shutting people down and
Right.
making walls.
Right. Well, and learning how to actively listen helps you get introspective about yourself and why you're doing things, what your motivations are behind some of the things that you're saying. Like, am I just projecting because I'm stressed about something else? Like, hi, it's me. But yeah, I mean, there's so many different rabbit holes that we could dive down today. But we could carry this conversation for hours and hours and hours and not be done.
Yeah.
Yeah.
But I think like, I was going to say this, I'm just thinking about like one of my patients, and like, how could things be different,
Mm-hmm.
and how can healthcare be different, and how can we be better informed, and how can we be better available for our patients. And I was just thinking, like, wouldn't it be so great if you could like interview your doctor,
Yeah.
and like go in for 15 minutes,
Right.
or have a 15-minute Zoom call and be like, are you really going to listen to me?
Yeah.
And who are you, and what sorts of things are you passionate about and interested in helping, so that it's much more personable experience.
I feel like you're just leading this into come see us at Farm to Table, which was
not intentional.
No, but it totally, I mean, we have free 15-minute calls with our providers, so you can do that thing and that exact thing, and, interview us as we interview you to see, like, are you willing to make changes in your life? Because we want to be here to help you do that.
Yeah. And I think more providers are becoming open to those sorts of things. I don't know that they necessarily advertise that you can do it, but I feel like I was talking to somebody and I was like, yeah, it'd be really great if I could just interview. And they were like, oh, we have 15-minute like phone conversations. You just have to ask. And I was like,
they're certainly not advertised, because with the medical system set up the way it is for billing and reimbursement and getting paid, like, you're not going to just volunteer 15 minutes of your time when you could be billing for an appointment. And I had never considered doing a 15-minute interview of anybody outside of like looking on the internet to see what their bio was like, right? Like, any medical professional I've ever had, the most I did was ask my cousin who's a nurse if this person was legit or not, right? Like, there's no introduction. You're just there in the office getting an appointment, right? But yeah.
Okay. So can we go into that a little bit about like the potential for trauma in that situation?
Yeah, absolutely.
Like, let's harken back to our first OB visits when we were 16 or 17 or 14 or
I don't know
12.
about you.
Like,
Mine
I
was
don't know.
very enjoyable and not traumatic at all. What are you talking? No.
Or
But
the
yeah,
first
like
time you
going
have to go by yourself.
right, right. Yeah, I mean, there's so many different ways that medical trauma can happen, medical emotional trauma can happen. And I mean, I think what it all comes down to is patients not feeling heard. I know that I have gone in, like there's a doctor that I could go on a half an hour rant about with my care at one point in my life. Did not listen to me, had no interest in what I was saying and my background and what I was bringing to the table, and just told me point blank, you shouldn't be doing this. This is stupid to do this. And I was like, you are the on-call doctor right now. And like, if I didn't have my own, if I didn't bring myself to the table in that space, like, I mean, I completely crumbled once he left. Like I was a mess. But I had my own back in that, in knowing who I was, what I wanted, what I was going to do. And most people don't have that luxury of knowing themselves well enough to be able to stand their ground and say, no, this is what I'm doing and this is what I want. And I'm going to advocate for myself. There isn't somebody next to you in the office most of the time when that's happening. And that is deeply concerning for a lot of scenarios that, I mean, I have been told and experienced myself.
Yeah. As my thought then is like, what tools do we use either as patients or providers? Like,
Right.
like if you were in that situation again, you know, give it like, and part of it, you're right, is like knowing yourself and having that confidence in yourself. Or like, if I was in that classroom, if I could like go back through the pen sieve and like sit next to myself.
Yes.
and have the courage to push back and say, no, this is important. What does this entail? What does it look like? And if you can't tell me because you don't know, then tell me who does.
Yeah.
You know, like, I'm just curious, like, where do you find that strength and where do you find that like wherewithal?
For me, it has come through literal years of therapy and coaching. Honestly, like I wouldn't have the confidence that I had without extra support from people. And the fact that mental health care is still such a taboo subject sometimes, like, just floors me because it's the best thing that ever happened to me. Whether I'm in the throes of, my own head drama, or whether I'm just, trying to learn more about myself so I can have an awareness that I didn't have before. But support from other people is my
Well,
and if something just doesn't feel right, that's where, social media can be great to find people. Like, I've had people put into words what I would never have been able to put into words, that like how to reach out. Like, I don't know where I'm going with this, but
but I think you have a good point about like finding your people and finding, my thought was like, oh, it takes a village, right? Like we say it takes a village to raise a child. Well, it takes a village to to raise everybody in the village and take care of all of the people. And like I would not be able to stand up to that particular professor if I had never found like a group of like-minded pharmacists and a group of like-minded medical professionals, and then also have validation from providers of people who are like going back to the therapist. And my therapist is like, no, you're not.
This is not okay.
Like, this is not okay. And you are not crazy. Your experiences are true and valid. And your path is your path. And it's a perfectly fine path to be following. And don't worry about these rest of these other paths that you're
Mhm.
not on, because you're not there.
Yeah.
And you're not going to you can't jump over there, and
Right.
it's probably not going to be any better.
Yeah. It's just going to make you mad.
Yeah. Yeah.
But yeah, I guess as we wrap up here, if most of us have probably experienced medical emotional trauma at some point in our lives, even if it's just not feeling like you're being heard by your providers. Like I do hope that everybody's in a situation where they can find a new one. But other than that, I mean, reach out to one of us on the team, or, one of us directly, and we can help with something at least, or, talk to your friends, talk to your family members, people you trust that can help lead you at least one step forward from where you are. Cause we don't want you to be sitting there feeling hurt and unheard and not feeling or not getting better, not healing yourself, not making changes that you want to make in your life.
Yeah. I'm gonna second the
Yeah.
finding somebody to listen.
Mm-hmm. Yeah. Somewhere that you can feel safe, and that is an invaluable place to be. Whether
Yes.
whether that's with friends or professional help, it's okay to hire somebody to hold that space for you that has been trained. And in a lot of cases, it can be better, because then there's not fear of judgment. There's not fear of repercussions. There's,
Yep.
yeah. So,
Yeah.
all right, Sarah, thank you so much for chatting today. I thought this was a super important topic. So I'm glad that we had a chance to make this happen.
Gladly. Thanks for bringing it up.
Take care.
You too.
Thank you for taking the time to listen in today. Many of you will be able to take the ideas that you've heard and apply them in your daily life, and that's really all you need. That's amazing. But for those of you who could use a little one-on-one help with how to make these things actually work for you in your real life, please reach out. The link to schedule a consult with me is in the show notes. You don't have to do this alone. See you soon.